Essentially, the goal of the public option, as stated by the proponents, is that what it will do is it will create competition with the private health insurance market, and thereby it will reduce costs by virtue of stimulating that level of competition. You know, I think my view of it is that, quite frankly, that it is down the path of what we call a single-payer system. And a single-payer system is essentially that the government will run healthcare in America as it does in Britain, as it does in Canada and other countries. And so, and the reason why I believe that is because of the fact I just don't, you know, even though the statement is made, well, government, well, that it will be under the same terms as the private sector. I mean, you know, in a sense, government defines its own accounting rules. You know, government doesn't pay taxes. Government has limitations in civil liability. And so, a great example of how it would work in the insurance market is really the state of Colorado. If we look at what's called Pinnacle Insurance in the state of Colorado, which is the legislature is debating what to do right now, whether that should move to be a private system or a public system. But essentially, it is a workers' comp insurance policy, I guess, that any employer can join in the state of Colorado. It started out as being an employer of last resort for where the private sector couldn't pick it up, that we would have this public option. And so, but it had, it's got that government limitations on civil liability, it doesn't pay taxes, and it's pretty much swallowed up most of the workers' comp market in the state of Colorado. I think that will happen nationally in health insurance with the public option.